Good morning, all of you, and welcome to today's session on Unacademy. So, this is a YouTube session of half an hour on lysosomal storage disorders. Can you hear me? Am I audible and clear? Okay, so lysosomal storage disorder, it's a again a very I got several feedbacks that it's a very complicated topic, it's very difficult to remember. So little bit of research, little bit of study, and finally we just got into a very good way of learning. Okay, so this is all about LSD. So today we are going to talk about the lysosomal storage disorders. For those who don't know me, I am Dr. Priyashri Mukherjee, educator in Unacademy. I teach pediatrics, and my YouTube code is Dr. Priyashri YT. Okay, so you can use this code whenever we are or you are taking up the subscription. So it will be like you'll get 10% discount. So I'll talk about the different subscriptions that we have at the end of this session. But right now let's go to the interesting way of learning the lysosomal storage disorders. Okay, so all of you ready? All of you ready? Yes? So what are the important lysosomal storage disorders? So two important lysosomal storage disorders is sphingolipidosis and mucopolysaccharidosis, isn't it? So sphingolipidosis and mucopolysaccharidosis, right? Now this sphingolipidosis, so which all conditions come under sphingolipidosis? Yes, can you enumerate me in the chat box? Which all conditions come under sphingolipidosis? Yes, whosoever is there in the group, please answer. No one? What are the sphingolipidosis? So we have the first, that is Tay-Sachs disease. Second, we have Niemann-Pick disease, isn't it? Third, we have Fabry's disease. Fourth is Gaucher's disease, right? Then what is the fifth one? What is the fifth one? We have Krabbe's disease, and here we have the Hurler, isn't it? Right? Now let us see how to remember the key features of these conditions one by one. Very simple mnemonic pattern, very simple way to remember. So let's come to our first slide. We have discussed this, that is Tay-Sachs disease. Okay, so when we are talking about Tay-Sachs disease, so as I told you, the short form is TS, isn't it? So let's see how we can use this TS. TS can be used in three ways. The first is the typical spleen, which means typically in Tay-Sachs disease the splenomegaly is absent or there is no splenomegaly. The second way to use this TS is typical sound. Okay, so typical sound means hyperacusis. And third TS is the tartar sauce, that is the onion skin of the lysosomes. So three variants of TS, how we can use it, three different features of Tay-Sachs disease. First is typical spleen, second is typical sound, third is tartar sauce. So tartar sauce is basically prepared from the onions, isn't it? So that is how you can remember that onion skin of the lysosomes. So it's not some tartar sauce appearance or anything like that. We have just used this TS in one more pattern to help you remember that tartar sauce is mostly made up of onion, and this is the onion skin of the lysosomes. Okay, so we got three things, that is no splenomegaly, hyperacusis present, and onion skin of the lysosomes. Right now, also when we are seeing Sachs, so Sachs can be written as 6. Okay, right, we pronounce it as Sachs and we can write it as 6. So this X or 6 can be used in two forms. First is hexosaminidase. So you can use it two ways, that either this X, and from this X you try to remember that the enzyme which is deficient is hexosaminidase. Okay, hexosaminidase A. The second 6 that you can use here is that 6 people means a gang, isn't it? So what is accumulated? It is the GM2 gangliosides. Very simple to remember, isn't it? So what we developed till now, three features, that is the typical spleen, that is no splenomegaly, hyperacusis, onion skin of the lysosomes. The third, then the fourth thing was which enzyme is deficient, that is hexosaminidase. How did I remember it? With the help of this X or 6. So 6 you can use in two patterns, hexosaminidase and gang of 6 people, that is gangliosides. Interesting? Okay. So this is the best way to memorize all the different features, important features, MCQ related features of Tay-Sachs disease. Okay. Now let's come to the next, that is the Niemann-Pick disease. Now when you are taking rounds, okay, with your seniors, so invariably when your senior palpates the abdomen, he has to find a splenomegaly or he has to find a hepatomegaly which a junior has missed out in his rounds, isn't it? So what would the senior say? Learn to pick up. So from Niemann-Pick we have the pick up word, okay, which our seniors often say, that pick up the spleen, learn to pick up the liver, isn't it? Most of us have experienced this during our early years. So this pickup means palpate the spleen. So there is an element of splenomegaly in Niemann-Pick disease. Also one important thing is splenomegaly. Spleen is big. That means what is happening? The spleen has got some fat in it. Okay, so this fat is nothing else but the lipid laden macrophages, and which are called as the foam cells. Lipid laden macrophages which are called as the foam cells. I can see that I'm coming in the picture, so I'll just write down over here, foam cells. Okay, so two things from Niemann-Pick. Pick is picked up the spleen, that is splenomegaly, and then the splenomegaly is there, that means it is obese. So obese people have fat in it, so there is a lipid laden macrophages which are often called as the foam cells. Also the second thing from this SP, you can remember one more thing, that the enzyme which is deficient is sphingomyelinase. Okay, so I always share this interesting thing with my students on Unacademy, that my boss, my teacher in biochemistry, had a very nasal twang. So whenever he used to say Niemann-Pick, then he used to continue as sphingomyelinase deficiency. So that thing has actually set up in our brain. So all of us, we never forget that Niemann-Pick is because of sphingomyelinase deficiency, and we remember it like that only. So you can remember it as it is. Okay, and what is accumulated? It is the sphingomyelin which is accumulated, right? Interesting. So now we are done with the Tay-Sachs, we are done with the Niemann-Pick, the key features. Okay, we are not doing the entire details because that much is not required in MCQs. These are the key features that are picked up for MCQs, and that is what you are supposed to do, and that is called as smart studying. Okay, now you can see here I have written TS and NP has got cherry red spots. So practically, out of all the lysosomal storage disorders, it is the Tay-Sachs disease and the Niemann-Pick which has typically got the cherry red spots in it. Okay, so this is the second condition which comes under lysosomal storage disorders. Now let's talk about the third thing, that is the Fabry's disease. Now Fabry's disease has got a triad. You can see here I have drawn a triangle. Very important question this is asked about Fabry's disease. The first part of the triad is peripheral neuropathy. PN means peripheral neuropathy. Second is angiokeratomas, and third is hypohidrosis. Okay, if you are able to remember it as it is, well and good. If you are not able to remember, just listen to this now. Fabry's disease itself is a mnemonic. Alright, so how we are opened it, you can see it on the slide. I have written it as Fabry, Fabry, and BRY, and D is for disease. Now F will mean that there is a your heart, which will mean heart failure, cardiac failure, and fail your kidneys, which will mean renal failure. Right. Now next is A. So A will stand for two things. First is the enzyme which is deficient, which is alpha galactosidase. Now how to remember whether it's galactosidase? A will remind you alpha. Okay. But galactosidase, this A and Fa. The Fabry is F is followed by A. So that A will remind you it's galactosidase. Again A over here. So three A's that can remind you the entire name. That is alpha galactosidase A, and the second A would be angiokeratoma. Right? I hope all of you might have seen a picture of angiokeratoma. Now the third is the B, that is burning pain in the extremities. This pain is so debilitating even for younger children that they cease to perform any activities. Okay. So this is a type of peripheral neuropathy. So that forms one of the triads. You can see here, isn't it? And the second triad we saw just now is the angiokeratoma. Now coming to RYD. Now if I rearrange it, this can be written as DRY, dry. So classical feature of Fabry's disease is dry skin, which is also called as hypohidrosis. Okay, now when we have a dry skin, what we use? We use a moisturizer, isn't it? And what is the key component of a moisturizer? It is the ceramide. So ceramide is the key component of the moisturizer. So that will help you to remember that what is getting accumulated. What is getting accumulated? I am writing it on in this corner. It is ceramide, trihexoside. Okay. So that is the key component which is getting accumulated in this Fabry's disease. What is it? Ceramide trihexosamide. Okay. Yes, any comments till now? Any difficulty in understanding this much? Yes, anybody? I can see some of you are there in the group. Any difficulty till this point? No? Okay. Now, one important point which I have written over here, you can see here, lipid inclusion with maltose. Okay, it crosses in the urinary segment. So this is one separate point that you can remember in Fabry's disease. Okay, genetics I'll be talking a bit later. Okay, because genetics is simple in this condition, lysosomal storage disorder. So just wait for some time. Let us finish the individual components and then we'll go for the genetics. Okay, so here we have done with the Tay-Sachs disease, Niemann-Pick disease and the Fabry's disease. Now let's do the Gaucher's disease. Okay. Now, Gaucher's disease is the most common type of lysosomal storage disorders. Hence, I think you might have solved several MCQs on Gaucher's disease. The most famous MCQ being the crumpled tissue paper appearance, isn't it? Now, the best way to remember all the points of Gaucher's disease is remember all the points as G. So, first G is giant spleen. Okay, so we have a hepatosplenomegaly present, a giant spleen present. So giant hepatosplenomegaly. Again, anything which is giant will have fat in it. So lipid laden macrophages, which can be seen in the liver, in the spleen, as well as in the bone marrow, right, isn't it? So these three areas you can see the lipid laden macrophages. Now these macrophages can be seen as the crumpled tissue paper appearance. Now coming to the second G is the glucocerebrosidase, isn't it? So what is the accumulated component? It is the glucocerebroside. Very simple. Now the other name of glucocerebrosidase is beta glucosidase. Okay, this is the other name of the enzyme which is deficient over here. So if you get in the MCQ beta glucosidase, don't get confused. So Gaucher has a U in it, so there is gluco, U, right? So these have helped me in solving my MCQs. Okay, even I have learned these patterns from somebody, some senior of mine, this type of studying, and I used it to memorize the lysosomal storage diseases, and trust me, it has helped me a lot to solve not only the MCQs but also to remember it in the long run. Okay, so I'm doing the same thing with you guys. I'm just sharing this way of learning the lysosomal storage disorders. Then third G is going down your blood count, which is the CBC. So CBC, pancytopenia, isn't it? Very simple. Fourth is going down your bone strength. So bone strength goes down is osteoporosis and bone crisis. And fourth G is going away your blood from the hip, which is the avascular necrosis of hip. Very simple. So what are the 5 things that we saw? First is the giant spleen. Second is the enzyme which is deficient, that is glucocerebrosidase. The other name is beta glucosidase. Then third G was the blood count going down, that is pancytopenia. Fourth G was the bone strength going down, that is osteoporosis or bone crisis. And fifth G was going away your blood from the hip, that was the avascular necrosis of the femur. Mostly it is like the femur which is affected over here, right? So now we are done with the 4 most important type of lysosomal storage disorder. Any difficulty till now? Anything that you did not understand? Anything that you want me to repeat, or I'll just continue it? Okay, now coming to the Krabbe's disease. So Krabbe can also be pronounced as crab, isn't it? The moment we talk about this Krabbe's disease, this crab picture comes in our mind, isn't it? So here I have a happy crab with a globoid body. A happy crab with a globoid body, isn't it? So from the globoid body, I can remember globoid cells. Okay, globoid cells. And from these different many legs of the crab, I will remember I will remember Multinucleated macrophages. Multiple legs, so multinucleated. What is multinucleated? Macrophages. So multinucleated macrophages which are PAS positive. Now these images gives us a very good visual impression, and we almost remember them whenever we use images to remembering. Okay, now coming back to the globoid cells. So this G will remind us that there is a galactosidase. Again, CRA. So there is no U in this, so it's a galactosyl ceramidase. Okay, galactosyl ceramidase deficiency over here, leading to the accumulation of galactocerebroside. Okay, and finally, if you see the eyes, okay, so basically the eyes will remind you that there is an optic atrophy in Krabs disease. So three important things from Krabs disease. The globoid body will remind you that it's a globoid cell you see in Krabs disease. This G will remind you about the enzyme which is galactosyl ceramidase, and that galactosyl ceramidase will lead to the deficiency will lead to the accumulation of galactocerebroside. And the multiple legs will remind you that this is a multinucleated macrophages which are PAS positive. Right? Now, coming next is the metachromatic leukodystrophy. Now, metachromatic leukodystrophy, you can see metachromatic. So, you can just remind this with memory. See, I know the spelling of memory is MEMORY, but for our simplicity to fit up in this mnemonic, that is how our boss taught us. It is MEMRY. Okay. Now, how am I using this memory? So dementia is one feature of metachromatic dystrophy, leukodystrophy, and this RE is reminding me that there is a deficiency of aryl sulfatase A. Again, this A will remind me that there is an ataxia. Right? So, three important things: memory causing dementia, ARI, that is aryl sulfatase A, and A causing ataxia. Very simple. Now, coming to the last, that is the mucopolysaccharidosis. So here I will be differentiating between Hurler and Hunter. So let's see what is the mnemonic that we can use for Hurler. Now see here, Hurler H, it begins with H, so there will be an element of organomegaly, isn't it? There is a HS megaly. Now with the now you remember when we are talking about Hurler, just remember this simple story that when you do gargling, breathing air is harder. So this harder, I am using it as harder. So that will remind me it's Hurler. So this mnemonic is for Hurler. Air is obstructed by water, so airway obstruction. So how I am using this little activity? When I am gargling, my breathing is getting harder and there is a airway obstruction. So this gargling will remind me of gargoylism, the typical facies of mucopolysaccharidosis, isn't it? You can see it right here. And the air is getting obstructed means there is an element of airway obstruction. Right? Now, coming to Hunter, which is a milder form of Hurler. Now, hunters need to have very sharp eyes and very aggressiveness, isn't it? So, there won't be any corneal clouding in Hunter disease, and corneal clouding will be present in Hurler disease, isn't it? So, this will be present in Hurler disease. Aggressiveness. So, a hunter has to be aggressiveness. So, this aggressive behavior will be seen in Hunter disease. Now, let's talk about the deficient enzymes. Okay, so the simple sentence that I do gargling and I am Hunter. Okay, I do gargling and I am Hunter. So the first I is for the Hurler. Okay, so gargoylism, gargling will remind me of gargoylism. Okay, this gargoylism means Hurler. So Hurler is I. The enzyme deficient begins with I, so it is iduronidase. The second I, so this is second I, so it will be like iduronate 2 sulfatase. Okay, iduronate 2 sulfatase. So so for Hunter, the enzyme deficient is iduronate 2 sulfatase. I do gargling and I am Hunter. Okay, so iduronidase for Hurler and iduronate 2 sulfatase for Hunter. Easy. Now coming to the last, that is the accumulated substrate. I think this is very easy to remember, that is heparin and dermatan sulfate. Okay, HD, heparin and dermatan sulfate. That has been asked as MCQs couple of times, so I think by now you are already aware of the accumulated substrate for Hurler and Hunter. Okay, now coming to the last, so this is another differentiation which we have already seen in that. Okay, coming last to the genetics. So remember that all lysosomal storage disorders, okay, they are autosomal recessive. All lysosomal storage disorders, they are autosomal recessive, except for two things, that is Fabry's and Hunter, which is X-linked recessive. Okay, because they are X-linked recessive, again they are very rare to occur. So you are a Hunter for your favorite X. So if you remember your college days, you always used to hunt for your favorite girlfriend, isn't it? So which has become an X right now. So you are a Hunter for your favorite X. So this Hunter's disease and favorite for Fabry will be X-linked recessive. So this is the simplest way of remembering the genetics, right? So that's all about the lysosomal storage disorders, short and sweet, covering up most portion of the lysosomal storage disorders, right? So I believe now you will be able to solve 90% of the MCQs. Okay, this is not a substitution of your self study. Okay, this is only to simplify your basic study skills. Okay, whatever you are reading for the first time, it is this mnemonic, this way of learning is just to give you an idea that how you can learn the LSDs. Definitely if you have more points to add on, you can definitely prepare your notes, definitely add on more points to the best way that you can do it. But remember, this is not a substitution for your self study. So work hard, study hard, read more, practice more MCQs. These are the key to success. And at the top of that, you need to revise, revise, revise. Nothing is complete without revising. Okay, so even before we got well versed with this pattern of reading, we had to revise everything 3 times, 4 times, 5 times. So revision is the key to actually having the thing impacted in your mind, right? And that is exactly what we do on Unacademy platform. Okay, so we have our study groups out there in Unacademy. We teach you as educators all the topics related to the subject, and not only that, we have many revision practices for all of you. Okay, keeping that in mind, we have got 2 subscription patterns. One is the iconic subscription and the other one is the plus subscription. Now what is this iconic subscription? You all know that the Unacademy and Prep Ladder has come together. So all benefits of Unacademy, that is the live classes, the live tests and the quizzes, the batch courses and the structured schedule, together with the Prep Ladder facilities, that is the video lectures, the question banks, the rapid revision courses, the handwritten notes, all of them together on one plate. So it's a good platter for all of you, and this platter is available in a very optimum rates. You can see here. So if you take the normal classes where you have to travel and go to long distances to study, some students are even staying in hostels to study, isn't it? So instead of doing that, you can take these subscriptions. Different duration subscriptions are available, which will hardly cost you maximum of 4K, and if you are taking it for a longer duration, you are getting it in a very minimal cost, that is 2300K. isn't it? 2300 rupees. So this, where would you get this? You would get only in Unacademy Iconic subscription. So guys, don't wait any further, don't hesitate, don't think much. We have our enormous academic sessions on Unacademy, which is actually so enormous that your preparation is boosted up to the optimum, and the results that we are getting with our students who have already subscribed with us is so marvelous. People are cracking their entrance exams in first go. So of course it is their hard work, plus also the hard work that Unacademy is putting forward for all of you. Okay, so looking forward to all of you to see you all on Unacademy platform. And before I leave, just let me remind you about my code, that is Dr. Priyashri -YT. If you like this method of reading, studying the lysosomal storage disorders, do give me a thumbs up. Share this video with your friends so that your friends will come to know about Unacademy. Subscribe the channel, okay, and thumbs up and subscribe and share with your friends. So this is all you can do. And also, when you are subscribing to the Iconic or the Plus, don't forget to use my code Dr. Priyashri -YT, which will yield you 10% discount. Okay, so this offer is going on. So thank you very much guys, stay safe all of you. See you all together tomorrow again, same time, with another new topic. Okay, so take care for now.